Okay, this video is from a lipidology conference of some cardiologists. It's from the American Journal of Cardiology from 1998. I'm going to show it to you because there's something funny about it. Okay, so this is a meeting where expert cardiologists and lipid experts were meeting in a conference, taking questions from the physician audience as well. So it doesn't give you their names of them, but it's in the journal, and it gives you the representative statements in the meeting. So the first one says, I think any patient that has cardiac risk should be on a statin. He might said, my primary goal, the most important thing with these cardiac risk, high-risk patients is to lower their LDL cholesterol. One of them says, well, I would discuss the Mediterranean diet. And another one says, well, with a few exceptions, I think a patient who's had a coronary intervention or a coronary event needs to be on a statin drug. Another doctor says, well, if the patient, cuts their dietary fat from 40% of calories due to fat down to 30% of calories due to fat, their LDL is only going to go down about 5%. On the other hand, if you put them on a statin, even a low-dose statin, you can get them to drop their LDL by about 27% pretty easily. Okay, now here's the big line. Here's what you want to remember. The other one points out, well, you know what? If we just put them on a low-fat diet, if we can get their dietary fat below 10% of their calories, then they don't need any drugs at all. And that's what I'm saying. The low-fat vegan diet, the Esselstyn diet, the Spartan vegan diet, my Spartan vegan diet, the McDougall diet. McDougall described his diet as about 7% of calories from fat. If you do that, your cholesterol lipid numbers are so good, you don't need any lipid cardiac protective drugs. That's what you want to do because your whole body's healthier that way. So then the question arises, well, is it better to lower LDL cholesterol with a statin drug or is it better to do it by diet? And of course, it's much better to do it by diet. Think about it. One of the side effects of a statin drug is potentially muscle weakness. It's a mitochondrial inhibitor. It also increases your risk of diabetes. So any drug that increases your risk of diabetes, there's a trade-off, okay? They feel that lipid lowering is more important to prevent myocardial infarction and to accept the risk of diabetes. How about no diabetes and no myocardial infarction by just eating a low-fat plant-based diet? That's the smart thing to do, okay? And this is a conference from 1998. A viewer just sent me this paper, so I looked at it, because the viewer wanted me to, I don't look at every paper viewer sent me, but this one, I kind of felt like I would, do them a favor. I've kind of known them. So let's see what else they say. Lowering LDL in clinical trials is shown to reduce the risk of myocardial infarction. Lowering LDL has also been shown to stop the progression of atherosclerosis in angiographic studies. Like remember the Blankenhorn studies? Any type of lipid. It could be MUFA, it could be PUFA, it could be SAT. So that means it could be olive oil. It could be cooking oils. It could be any of them. They all increase atherosclerosis risk. So the only way you have a high chance to really lower your blood lipids is by minimizing your dietary lipids. Same thing in monkey studies. Okay, lipid-rich diets, high-fat diets, they cause atherosclerosis. Okay, when you lower the serum cholesterol, endothelial cell function improves, you get more nitric oxide release, which is antiplatelet, preventing clotting, meaning preventing atherosclerosis, and also vasodilatory, lowering, optimizing blood pressure. The lipid and macrophages are cleaned out pretty fast from the plaque. The residual plaque is more fibrosis, collagen, so it's more of a stable plaque, like an old scar, even if the stenosis does not significantly reduce because the vessel has more nitric oxide. It's a better vessel. It's less likely to progress or ever have a myocardial infarction, for example. Another one pointed out, they started talking about olive oil. And one of them said, well, gee, the Chinese on low-fat diets do better than the Greeks on low-fat diets. And they think the olive oil is the problem. They think olive oil makes them worse, okay? They briefly then talked about children and talking about, kids should eat a healthy diet. And they said, after 2 years of age, they think that a kid should basically be thought of as like an adult as far as dietary fat is concerned. I would say it doesn't really matter, when the kid's young, before they hit puberty. I mean, you don't see myocardial infarctions in regular kids. Sickle cell anemia can have myocardial infarction because that's prothrombotic, but a regular kid's not going to. So that's a non-issue, I would say. But the bottom line is lower dietary fat means lower cardiovascular risk. I think I got maybe one more page. The only reason I showed this last page was so you can see the reference if you want to look it up yourself. American Journal of Cardiology, November 1998. So anyways, I just thought that was kind of amusing. What was amusing about it, the reason why I showed this paper was I just thought it was funny. They've known this for a long time. We've known this since Kempner, since McDougall, since Pritikin, since Ornish and Esselstyn. If you lower dietary fat, you lower LDL and you lower cardiac risk, bottom line.